Thank you, everybody, for joining us tonight. My name is Michelle Lorenz, and I am with an organization called Everything ALS. And our goal is to bring the researchers to the patients and connect them with the top world-renowned researchers around not just the United States, but around the world, and also to work with our legislators trying to get laws passed that will help people with ALS get more access to some of these therapies that are in clinical trials and to speed up that clinical trial process for this disease. I'm joined on this call by my partner in crime, Mayank Saxena, and he has been a champion trying to fight for new legislation for his sister Mayuri. And we have joining us today a panel of other physicians on this call who either themselves are affected by ALS or have family members or friends who are affected by this disease. And you're going to hear from all of them. But for those of you who may not have a background with ALS, I'm going to give you just a 5-minute primer of it, and then we're going to turn it over to the people that you came to hear from. So ALS is a rare neurodegenerative disease. We have about 30,000 people in the United States who have it, approximately 450,000 around the world, according to Johns Hopkins. And this disease, what it does is it kills your motor neurons, not your sensory neurons. So people with this disease still feel pain. Unlike quadriplegics, they're still going to feel pain. They're still going to feel hunger. They're still going to have an itch. But the motor neurons that go from their brain to connect them to their muscles, those are the neurons that die. And so their muscles ultimately atrophy because they don't get the signals to work anymore. And so before this disease kills people, and it is unfortunately 100% fatal, it is untreatable. In 150 years of this disease, we have never had a disease-modifying treatment. And unfortunately, before it kills people, it paralyzes them. So it paralyzes both their gross and fine motor skills. It paralyzes their muscles and their ability to speak, breathe, eat, and swallow. And it paralyzes their intercostal muscles around their rib cage, which allow them to breathe. And so it is a long, torturous death. And it's perhaps, in my experience, one of the most difficult diseases for anybody to have. One of the other things that makes it so difficult is we've never had a treatment for this disease in 150 years, but it's very rare amongst other diseases because there's 4 pillars of medicine, if you will. We don't have a way to prevent this. You can't take statins, you can't exercise, you can't stop smoking. We have no biomarkers. So I know we have a radiation oncologist on the call tonight. There's no x-ray that you can do. There's no biopsy you can do of your neurons. There's no cancer antigen you can do with a blood test. We are pushing and striving to find biomarkers so we can help not only with diagnosing this disease, but tracking its progression, that as of today, we have none. We have no disease-modifying treatments. There is one drug on the market that extends your lifespan by about 2 months, but it is at the end of your life when most people with ALS are not interested in extending that. We want to try to rectangularize that lifespan. And then in addition to that, there are no cures. Most of the top ALS researchers that we speak to around the world tell us that the treatment and cure for ALS is likely to be much like HIV, where we are going to develop a cocktail of drugs. And one of those drugs may treat neuroinflammation, another drug may treat mitochondrial dysfunction, yet another may deal with our neurotransmitters, another may deal with autophagy or misfolded proteins. So we've got about 10 different clinical pathologies that happen at the cellular level that are all impacted by ALS. And then, unfortunately, one of the things that makes this disease so difficult as well is, yes, it's a rare disease. So we have the problems that all rare diseases have. We have a really small population and it's underfunded, but then it's complicated even further by 2 other factors. Because the disease is always lethal, always fatal, and because it proceeds to lethality rather quickly, we exclude a significant amount of our population from the trials. And so about 3% of our 30,000 patients qualify for trials. Everybody else has no options. But the thing that perhaps makes this disease the most difficult to find a treatment for is the same thing that plagues other neurodegenerative diseases like Alzheimer's or Parkinson's. It has vast heterogeneity. So for those of you that aren't the physicians on the calls, what that means is a whole lot of causes, a whole lot of pathologies, a whole lot of different phenotypes, what happens to the symptoms on the outside, but also a significant number of genotypes. We have about 30 genes that all cause ALS. Some of those genes have 50 plus mutations. Some of them have 185 mutations. And each of those mutations has a different phenotype that goes along with it, along with progression and onset. And then we have another group of about 150 genes that are polygenic that combine and make it difficult for a drug manufacturer to target just one of those genes to cure this disease. And that's just about 10% of our cases. The other 90% of our cases are they're called sporadic, caused by a variety of different environmental exposures. And those are things that make it, again, even more difficult because we don't even know for sure what causes it. We only have associations at this point. And so when a manufacturer tries to find a treatment or a cure for this disease, it's complicated by all of those processes. And then it makes our clinical trial processes difficult as well. So what we're trying to do with this bill is to fix that a little bit. So what the bill does is three primary things. If you all remember Right to Try was what we introduced thinking that it would help with rare diseases. So this bill, the blessing of it is bipartisan support, and it marries the humanity of Right to Try by allowing patients to get access to drugs in clinical trials, but it keeps the FDA in the loop with several layers of FDA oversight. And that's so important. So this particular law is going to create grant funds for people who have ALS, and it's going to allow them access to only drugs in phase 3 trials because we wanted to make sure it passed phase 1 safety and phase 2 efficacy. Our phase 3 trials are usually around 100 patients. And then it's also, in my viewpoint, it's going to limit these grant funds to only small biopharma companies. So the large pharmaceutical companies that currently fund expanded access will not be able to get access to these grant funds. But in my viewpoint, the single most important part of this bill is the third part of this in that expanded access arm, where the drugs that are in those phase 3 trials, the grant funds are only going to be able to be used at the clinical trial sites conducting that phase 3 trial. So the IRB will already be done there. It's going to minimize the administrative costs, but the single most important part, I think, is that those principal investigators who are collecting the data in the double blind are also going to be able to collect the data with all of the people that participate via expanded access, that other 97% of our population. And so that's a summary of what this bill does. On the House side, we have roughly 275 sponsors. We need 291 to get it to a vote on the House. On the Senate side, we're just getting started. We have about 10, but we feel pretty confident if we can get a vote in the House that we can also get it passed in the Senate. This session is critical for us because unfortunately we lose about 6,000 patients to ALS every year. And they die waiting for access to a single drug that can help them change the course of their disease. And so that is why we are all here. And we are hoping that the voices of all of these physicians and Ph.D. neuroscientists on the call will help you understand why this is such a critical bill and why they support it. I am going to silence myself and start with Shah. Shah is a physician along with his two brothers, and I'm going to allow you to unmute yourselves. I know you have something you want to read on behalf of Shah. So I put my glasses on to make sure I'm unmuting the right people. There we go. Anush, I've given you and your brother both. Go ahead.
That's right. I'd like to begin. Thank you, Michelle, for the excellent introduction. My name is Ardalan Minokadeh. I'm a dermatologist in West Hollywood, California. I'm the youngest of 3 boys. My middle brother, unfortunately, was diagnosed with ALS. I'd like to have my oldest brother, Anushirvan, who's also on the call, introduce himself, and then I'll start with a prepared statement that my brother Shah wrote, and Anush will finish.
Great. So thank you again. It's my pleasure to be here. My name is Anush Minokadeh. I'm the oldest of the 3 brothers. We're all physicians. I'm an anesthesiologist and I do neurointensive care, critical care, neurointensive care medicine, and I'm at UC San Diego. We've been witness to a lot of the things that you mentioned since 2011, since his diagnosis, and so we're rather passionate about trying to get this bill passed. So thank you so much. I think Ardalan will get started with Shahir's statement.
Yes, and he wrote this, what I'm about to read. Thank you for this opportunity to tell my story and advocate on behalf of myself, the ALS community, and all patients and loved ones affected by neurodegenerative diseases. As a brief introduction, I grew up in New Orleans, Louisiana, as the son of an anesthesiologist and one of 3 sons who all pursued a career in medicine. I was accepted into an accelerated medical studies program where I finished the bachelor's degree and medical school at the age of 24. I went on to train in anesthesiology at Johns Hopkins and subspecialized in pain management at UC San Diego. I felt on top of the world and was in the prime of my life, having just met my future wife when I received the devastating diagnosis of ALS at 35 years old. This was a complete shock as I was otherwise healthy and had no family history of ALS. I received my diagnosis from a physician who was an expert in ALS and had, by his own account, dedicated 30 years of his life to seeing ALS patients and studied the disease. Despite this, there was no actionable guidance on what to do. This was not a new disease. It was first described over 150 years ago, yet there was no treatment that offered even a 1% chance of survival. There were no solid answers on what, if any, dietary changes I should make, or whether or not I should exercise or not exercise to strengthen muscles. I was fortunate to find a small clinical trial and enrolled despite an inhumane protocol that would leave 1/3 of the patients without actual treatment during or after the trial. As a physician, it was unimaginable that this had been allowed in a 100% rapidly fatal disease. But let's fast forward to today. I've been locked out of any clinical trials or access to investigational treatments since 2013 because of trial restrictions. My family, friends, and I have corresponded with the FDA, pharmaceutical companies, and neurologists countless times. Despite my own medical background, knowledge, and connections in medicine, I've not been able to access a single investigational therapy for 7 years. The existing pathways of right to try, compassionate use, or expanded access to this day have only been empty words used to tell the hopeless and dying that something has already been done for them. I and many other ALS patients heard these words repeatedly, and unfortunately, most died while they fought and realized that these pathways provide no access for ALS patients. It's horrifying. And this ALS horror can happen to anyone at any age. ALS is classified as a rare disease because we die so quickly that our numbers remain small. ALS is not rare. I feel it's worth saying again, ALS is not rare. This can happen to you or someone you love. I'll pass this to my oldest brother to continue.
So my situation is not unique. This is the current horrific reality for everyone affected by ALS. This is why passing the Act for ALS Bill in this Congress is so crucial. Delaying the passage of House Bill HR 8662 and its Senate companion bill S 4867 will result in tremendous suffering and death by withholding access to treatments for terminal patients. Patients like myself can benefit from promising experimental therapies and benefit from the funding of expanded access programs and open label extensions. It is quite literally a bill of life or death. Concurrently, it maintains FDA oversight. It accomplishes the FDA goal of collecting more data. It gives people with ALS the same expanded access to promising therapies as Americans with other common disease. Act for ALS speeds up development of potential life-saving treatments by creating a grants program that invests in promising neurodegenerative disease research. Act for ALS facilitates greater coordination of federal government efforts in the fight by creating an HHS collaborative for neurodegenerative diseases. The HHS collaborative will pull in patients, physicians, advocacy groups, researchers, and drug manufacturers at the same table with the FDA, NIH, and CDC. This will allow a much more efficient and effective partnership to tackle the scientific and regulatory challenges with neurodegenerative diseases. This bill is humanity. This bill is science. This bill is long overdue. I urge you to join our colleagues on both sides of the aisle and co-sponsor Act for ALS today. Thank you for your time. Share Minokadeh, 44-year-old physician dying of ALS.
Thank you, Shah, for sharing your words and for being so courageous. We honor you. Dr. Sinnott, Bob Sinnott, would you like to go next?
Oh, sure. I'm Bob Sinnott. I am a colon rectal surgeon. I was diagnosed officially in January of 18, although I had issues prior to that. I had limb onset. I had surgery on my ulnar nerve and then surgery on my cervical spine. But I really didn't make progress, and I was officially diagnosed. Like many docs, I sought additional opinions, and the diagnosis was always the same. And I realized then that neurology, their most important role is to make the diagnosis. And there's very little to offer after that. all of these evaluations, I was told there were two drugs that basically don't do much. And then you're offered the opportunity for a clinical trial. And as has been stated, there are so many exclusion criteria that many people can't participate for many reasons. My personal journey is I initially was in the brainstorm trial, but I couldn't reconcile to myself or my family the 50% chance of placebo. Therefore, I traveled to Seoul, South Korea for a stem cell treatment with neuroprotective agents. Now, imagine that. I'm a doctor in this great country, and I had to travel to South Korea. I was fortunate because I had the means, but most people can't. It's expensive and it's a 14-hour plane trip. So, excuse me. So I urge everyone to support these bills to allow people to have at least a chance in the fight. Because right now it's not a fair fight. There's nothing available outside of a trial to give us a chance in this fight. That's why I went to Seoul. I think the expanded access makes sense. I think what we're asking in these bills makes total sense. I can't imagine why any politician would not support it. This is not a partisan issue, and I urge everyone to please support this legislation. I'll stop at that.
Thank you, Dr. Sinnott. And next, Darren is a neuroscientist who himself, he also has ALS. And Darren, I don't know if you or your spouse or caregiver is going to be speaking for you. You can unmute yourself. Go ahead.
You're going to speak on yourself?
Okay, feeling myself. So I dedicated my life to studying neurons.
So he's dedicated his whole life to studying neurons.
Yeah. And therefore, I traveled to USA.
And therefore, he traveled all the way here to USA.
Yeah. So work on development drugs to combat neurodegenerative disease.
And so he's traveled all the way here to the US so that he could have this opportunity to, work on drugs to combat neurodegenerative disease.
Darren, can you ask your partner to speak up just a little bit too when she talks? It's a little bit quiet, so go ahead.
All right, I'll do that.
Then I know I would be one of the patients.
Little did he know that he would turn out to have neurodegenerative disease himself.
Yeah. I first follow up in the lab when I was 5
He first found out in the lab when he was pipetting.
That was 6 years ago.
That was 6 years ago.
So still I continue to work in the field.
So he still, despite having symptoms, he still continued to work in the field, to try and help other people.
So I urging Congress and the Senate to pass this bill to give us a chance to fight.
So he's begging the Congress and the Senate to pass these bills to give him a chance to fight.
So I see my daughter was 10 this year to college.
So he can see his 10-year-old daughter to college.
Yeah, that's my story.
And that's his story. Thank you.
Thank
Thank you, Darren. And Mayank, do you want to introduce the next speaker? Because I know you have.
Sure. I think we'll go now to Dr. Patel.
Sure. Thanks, Mayank, for the introduction there. My name is Suchit Patel. I am an MD Ph.D. I have a Ph.D. in neuroscience. I am a practicing radiation oncologist. I've known Mayank and his family for about 20 to 25 years now. I've lost count. I'm a childhood friend of Mayuri's who I've seen suffer with ALS. And I think you guys have heard enough personal stories that I don't want to bore you with that. But what I do want to tell you is focus on the bill that is at hand here and why, as a physician and also as somebody who's been directly impacted with one of my close friends having been diagnosed with ALS, why the bill makes sense to me. So the bill, as far as I understand it, has three components. The first one is the expanded access. And I think expanded access is clearly not a partisan issue. It is a humanitarian issue that allows us to continue to have scientific progress for rare and difficult to treat disease in a way that marries clinical trials and humanitarian access with scientific progress. It allows for expanded access to drugs that are promising under the umbrella of an existing FDA oversight infrastructure in a safe way where those drugs would be, where those drugs would have greater access to patients at phase 3 clinical sites only. I mean, to me, that's a no-brainer about trying to get a drug in the hands of patients that need it most, that could have potentially life-altering impact in a way that's safe and administered by experts that are already doing that in a phase 3 clinical trial site. I think that makes a ton of sense. Part of the challenge that why this has been so difficult in ALS is because of the rarity of the disease and how trials have to be structured for a disease that is universally fatal and rapidly progressing. You know, there was a recent trial that Michelle mentioned at the beginning of this that failed to meet its endpoint and was declared a failed trial, and yet had 35% of patients that had an objective response. As a practicing oncologist, if there was an oncology trial that had a 35% objective response rate, we would be rejoicing for a rare oncologic condition. That would be an amazing trial. And yet for ALS, we declare that as a failed trial. And that's only because of the structural limitations of a clinical trial in a rare neurodegenerative disease, again, that's universally fatal. So to allow expanded access would broaden the denominator of those patients and therefore allow us to find a signal for a trial for a promising drug that's just harder to find, that we can't do because our trials are so small in ALS. So I think that's one part that I really want to mention, why I think expanded access makes a ton of sense. And then the other part that I really want to highlight also is the third part of this bill, which allows for increased funding for other universally fatal neurodegenerative diseases. The third part of this bill is to increase funding for rapidly progressing neurodegenerative disease. You know, as a scientist, one of the things that over the last 50 years in biologic science progress that, you know, I mean, Darren and David, I think, can both speak to this, is scientific progress in one area of medicine has tremendous halo effects in other areas of medicine. So by increasing funding for rare neurodegenerative diseases It's not like saying we're devoting $100 million only to ALS. It's saying that we are increasing funding for scientific progress in neurodegenerative diseases. That includes ALS, it includes Parkinson's, it includes Alzheimer's, that includes Huntington's. When you start thinking of neurodegenerative disease and things that can change symptomology or change progress in one of those areas, that's a whole range of diseases that comes out of that have impacts well beyond ALS. So I think just those two alone, I agree totally with what Bob said earlier, that this is clearly not a partisan issue. This is a humanitarian issue, and it moves the needle on both humanitarian access and scientific progress. I think the bill in the House clearly has broad bipartisan support, and I hope that we can see this move forward.
Thank you very much, Dr. Patel. I'd like to go on to Dr. Baxter, if you would like to introduce yourself.
Thank you. My name is Dr. Michael Baxter. I'm an assistant professor of pediatrics with the University of Oklahoma in Tulsa. So I'm a little unique probably with this group in that I'm a pediatrician, and in pediatrics, ALS is very rare. So I don't actually treat patients with ALS, but I do have interactions with their families. So for the children that are impacted by this as their family members go through ALS. So this can be from older teens who are learning to understand, they have the ability to understand what's going on with their family member, and they choose to make sacrifices to help care for their parent, or to younger children who developmentally just don't understand why their mom or why their dad can no longer play with them the way they once did. And this has drastic impact on children's development. So my connection is my good friend Betsy, who I've volunteered with for years on a board for children's education at our church. We are also had been fellow runners together, and our children have gone to school since the first grade for her youngest, and I've been seeing her children grow. And even her middle son and my daughter are in marching band together. And after her diagnosis, she wasn't able to attend some of the marching band events, and my wife went as the chaperone for her son so that he could participate. So I've seen the direct impact that this has on the children, and I know how it impacts the parent who's living with ALS. So I am asking you to support the Accelerating Access to Critical Therapies for the ALS Act, specifically the expanded access through the FDA. I agree with what everyone has said, is this is just showing the humanity. And one thing that I know that we need to give these patients, and we need to give their families and their children, is hope. And so that they can have some hope as they go on. And this has such a wonderful impact on children's development. It has a wonderful impact to see their parents have hope and to do that. So I hope that each of you will sign on as a co-sponsor for this very important bill, and that we can make progress, and we can cause a positive impact, not just for the patients with ALS, but for their family members, the children, and the community as a whole, because we know that this disease does not just impact a single person, as we've seen already today, and it impacts the entire family and community. So please sign on, and thank you for your time.
Thank you, Dr. Baxter. If we can go to Dr. Dayal right now.
Hi there, my name is Molina Dayal. I'm a in vitro fertilization specialist in St. Louis, Missouri. My educational background is one where I went to medical school at Johns Hopkins University in Baltimore, followed by residency in obstetrics and gynecology at Washington University in St. Louis, and then did my fellowship at the University of Pennsylvania in Philadelphia. Both Dr. Patel and Dr. Baxter have mentioned valid reasons and very important reasons for passing this bill. I come to you because I've been personally affected by this. As a medical student at Johns Hopkins in the early 1990s, one of my very first patients that I took care of was affected by ALS. At that time in the 1990s, what was interesting is that there was a special unit for HIV. HIV was a relatively new phenomenon. We knew it was, at that point, uniformly deadly. And I think back and I look at the care that we were able to provide for this ALS patient, which was not much, it was supportive. And, you know, I was acutely aware of how much that, that ALS affected not just the patient, but everyone around them, whether it was their family members, medical staff, the team. And, you know, 25 years later, you know, HIV now is considered a chronic disease. It's not one that's uniformly fatal, but nothing has changed with ALS. It's uniformly fatal. And it's amazing to me that a country like ours is one that has the most advanced medical care of any place in the United States. And yet we've gone nowhere with this particular disease. I'm an in vitro fertilization specialist. And my field is exceedingly controversial. And we talk about embryos, we talk about life, the beginning of life, but we make advances every 2, 3, 4, or 5 years. And despite how controversial we are, we've done it. But ALS, there's no controversy about this. It is a uniformly fatal disease. And this is a bill, or these are bills that need to be passed in order to provide a chance at life for these individuals. I'm personally affected because my Yuri is my niece, and it's been devastating watching her. And I really wish and hope that you consider this. Thank you.
Thank you, Dr. Dayal. If we can go to Dr. Pai, please.
You're still muted. We can't hear you.
I think you're, sorry, I think Dr. Pai, you're muted, or at least we can't hear you on your end. But maybe we can, until we could go to Martha Beach.
Hi, thank you. I'm a nurse practitioner. I practice with the Department of Veteran Affairs. I've spent 25 years in the field of neurocritical care in the neuroscience field. My grandfather died of ALS. I did not know him, but the impact that it made in our family was one that I did not want to have anything to do with ALS. So I chose to study, and I worked at the University of California, San Francisco, did my residency at Stanford University, and also was at the Ohio State University, studying traumatic brain injury and spinal cord injury. And I now function primarily doing surgery of the spine. My husband was diagnosed after, at the age of 53, May of 2019, of ALS. And because of my fortunate experiences, my career, my colleagues and physicians rallied. Many of them are friends of my husband's, and got us immediately. I think we're in the best hands possible at the University of Massachusetts. And like Dr. Sinnott, prior to COVID, we were on our way to Korea, South Korea as well. And that, and we were conflicted somewhat, but we went through the same decision tree of deciding what we were going to do in terms of his treatment. But what has surprised me, as others have said as well, how little has been discovered in terms of a treatment. And I tell people, we're not even looking for a cure. We just would like care, just treatment. And I know that there are treatments out there, and I think it's unfair that a rare disease like ALS that's so rapidly progressive eliminates so many out of these trials. And these people are being victimized because the format and the design of these studies doesn't allow for adequate, as I don't remember who said it, you would rejoice at 35% of a rate where you found a positive response. These treatments give hope, and we need hope. That's just as important. And this bill would give not only hope, but it would expand the access and give the clinicians and the scientists what they need with a larger sample, and to apply it to what we're rapidly learning, because we do know a lot about neurodegenerative diseases such as MS and Alzheimer's and Parkinson's and many others, Guillain-Barré. But I believe that this is a multifactorial process. And I also think beside the clinical trials, there's also procedures, I think, that may be a value as well. But I think the first step is to pass this legislation and to give hope and to give therapies. And I don't think this is rare. In the time that my husband's been diagnosed, I do believe the incident rate, the prevalence may stay stationary because of the number of people that we lose in society. But I do believe that the new cases, the incident rate is much higher than we realize. The registry that we have at the CDC right now does not capture, if you're not part of the Department of Defense or Medicare, the only other way that those diagnoses get captured is if you register yourself. And my husband was one of those that did not meet those criteria for the registry. So I think there's a lot more people with ALS, new cases. I know for me personally, the number of people just since May of last year around us that have come to us and found out about our experience. I find it very hard to believe that someone will know someone affected by ALS, and it doesn't just affect them, it affects the entire society around them. Thank you.
Thank you, Martha. Dr. Pai, do you want to try again if your mic is working? Oh, I guess not. Sorry. Maybe you can go to Dr. Bhan.
Thanks, Mike. I'm Dr. Adarsh Bhan. I'm a cardiac electrophysiologist. I'm working here in Chicago as the chairman for Department of Electrophysiology. I'm not a neurologist, but I do know enough how important this bill is. And personally, I call it the Mayuri bill because Mayuri is like my child. What is sad is she is suffering, yet she's staying so strong and fighting for all the ALS patients out there. It's already tough to have a rare disease, and as many have said, maybe not a rare disease, but even worse, to have no treatment options out there with 100% mortality. So much progress has been made in our field, but so little in the therapies have come around for ALS. In my greater than 30 years of practice, I have seen many patients of ALS too. One of them being my very close electrophysiologist colleague, a very sharp physician, and it was sad to see him slowly give up and die. He saved more than 1,000 lives, but there was nothing that could have been done to save him. For a physician, there is nothing worse than a feeling of helplessness. Now there seems to be a light at the end of the tunnel. I feel it would be totally immoral to deny anyone with ALS the chance to get a treatment that could be life-changing and saving. I pray and plead to Congress to get the bill passed as soon as possible. Thank you.
Thank you, Dr. Bhan. Dr. Shapiro, would you like to go?
Sure. Thank you so much for having me. My name is Kimberly Shapiro. I'm a psychiatrist. I work outside of Los Angeles, California. I have a lot of experience with end-of-life care for patients, caregiver support, geriatrics, Alzheimer's. And I have a close personal connection to ALS because a very good friend of our family, a father figure of mine, is currently affected, and seeing how it's the ripple effect, like somebody else said, to his family with a lot of young kids is pretty devastating. I echo what someone else said earlier, that what's difficult about this illness is that there really is no hope. And hope is something that's really important from a psychological perspective when trying to help a patient throughout their disease state. Without that, things can go worse more quickly. Other diseases, cancer, have a lot, are a lot shinier, a lot, have a lot more support. And people who have that illness, while devastating, they can at least say there are treatments, there is some possibility, and there is hope. And theoretically, neurology and psychiatry have been really behind other medical specialties over the past century. We're mostly palliating symptoms, dealing with a lot of chronic illness compared to other specialties. 21st century should be the age of neuroscience, when we really start catching up with other disciplines. Again, there's just absolutely no reason why people with ALS and these other neurological illnesses should not have parity. It would just affect so many lives, like everybody has said, other neurological illnesses that we're essentially using treatments for to treat patients with ALS at this point. So thank you for having me and for your consideration.
Thank you, Dr. Shapiro. Dr. McCue?
Hi, my name is Brigid McCue, and I'm an OBGYN in New Orleans. I am here for my friend Betsy Elizabeth McCormick, who is a professor of law at Tulsa, University of Tulsa. I was privileged to accompany her to one of the first trial discussions that she had. She went to MGH Boston from Tulsa in order to hear about any trials that might be open to her. And I met her there, and it was very interesting from my perspective, hearing how things were presented to the patient and what the hard reality was of these trials. She fortunately was able to be enrolled in the stem cell trial and had a good outcome from that. But my feeling coming away from that experience of seeing all of the decisions she had to make and the choices she had to make for her 3 teenage children was just how important hope is in this process. So I, with my cold, hard medical eye, really couldn't see a lot of value to these trials. Taking time away from her family and having to have ports placed, and it all seemed like a lot of effort for not a lot of gain. And now, having seen her gone through this, and probably 2 years into it, I have so much appreciation for the value of hope, so that even if the patient benefits only a little bit, to be able to offer hope to her family and to other patients is really important. So I hope that this bill is supported, because even if there's only a set number of patients that could be helped, hope is really important. Thank you.
Michelle, do you want to continue introducing?
Sure, you're going to make me put my glasses on to be able to see who everybody is here. Dr. Campbell has not spoken yet. Dr. Campbell, would you like to join us?
Yes. Hi, I'm Lauren Campbell. I am a dermatologist in Houston, Texas. And this is the first time I'm really talking publicly about everything that's going on with my family. I'm personally affected by ALS because my husband, who will be my husband of 10 years in May, was recently diagnosed. This is still a new situation for our family. He just started having symptoms in May and was formally diagnosed in July of 2020. So, going through the pandemic and everything, and then all of a sudden your, personal world is turned upside down. I don't think our story, after hearing everything that everyone on this call has gone through and everyone, your loved ones is going through, is really no more or less tragic than anyone else's. But we do have 3 young children, 3 boys that are 7, 6, and 2. So all very young, really too young to understand what's going on. And that's, still something I'm going to have to grapple with, is explaining it to our children. And they, of course, know something's going on, but they don't really understand what's going on or what the, greater implications of that are. So that's all still something we're figuring out. But I think where I have a unique perspective is, number one, I do actually run clinical trials in dermatology. So being able to compare what my patients go through versus what an ALS patient goes through has been quite jarring. If my patients with, for example, psoriasis or atopic dermatitis have a 1/3 chance of being on a placebo, I think that's one thing. But if you have a fatal neurodegenerative disease and you have a 50, 33, 25% chance of a placebo, it's a very different thing. Also, our placebo-controlled portions of the trial are very short, usually 12 or 16 weeks, whereas an ALS patient, such as the trial my husband's currently in, it's 24 weeks. That time can never come back to you. Once you're declined, usually it's permanent. I think that's a huge thing that legislators and the FDA and other people that are involved in designing and regulating these trials need to understand. I don't think a placebo-controlled portion of a trial is appropriate at all for ALS patients. It just seems, unbelievable to me. I think the second thing that I have to contribute here is just my perspective that I cannot imagine someone being in a better position than my husband to go through this, given that he has a physician wife. We have the resources to get him the things we need. We live in a medical city like Houston. Because of my personal connections, I was able to get him into a neurologist within 2 weeks of symptom onset. I was able to get him to one of the top ALS centers and top ALS physicians in the world within weeks. And still, these things have gone so poorly. It's still overwhelming. It's still confusing. He's still not getting better. There's still nothing to offer him. And to me, that's just unbelievable. And every time I think about people who have, don't have that kind of support and don't have that kind of access, I just cry. I just can't imagine. We have the best available to us, and it's still the hardest thing by far that any of us have ever faced. And that's with the best of circumstances. And it's just unbelievable to me that a disease that we've had around for so long, we have essentially nothing for people. It just blows my mind. And the third thing is why I think this bill is so important is our physician, Stanley Appel, has done a study with effective results. He essentially stopped or reversed symptoms with his T-regulatory study. And because of funding, he hasn't been able to get the phase 3 of the trial even going. How frustrating is that there is something potentially at our fingertips in our city by our physician that could potentially help my husband and other people, and we can't access it for God knows what reason. So any expanded access for ALS patients is just could be life-changing for people. We are on the cusp of so much here. It's not just a hopeless, let's throw these people a bone thing. There are so many things out there that if we were, if this is a side note, but if the, FDA could give emergency use authorization to AMX 0035, if the neurone trial can be better funded, if the T-regs, we're there, but we just don't have time. We don't have enough time. We don't have any time, actually, because people with ALS don't have time. And so this is urgent. And this is something that I urge every legislator to support. And, I would really like it if my husband could see his 2-year-old son grow up. So thank you.
And Mayank, is it Sonia or Sona? I'm not going to pronounce your name properly.
Yeah, Dr. Bhatnagar. Sona.
Hi, this is Sona Bhatnagar.
Sona.
Thank you again for the opportunity to talk. I'm an internal medicine doctor practicing in Maryland for 27 years. This is personal to me because I have my niece, the warrior woman, heroic Mayuri, We all know about her, who's 36 years old and has been diagnosed with ALS. And she is totally paralyzed now. The only thing she can do is blink her eyelids, and that is it. She has a tracheostomy. She's on a ventilator to help her lungs move so she can breathe and take in oxygen. Things most of us take for granted, she is unable to do. I mean, a little thing like rubbing an itch on our nose. Do you know how irritating that is? People like we who don't have ALS don't even need to think with our pea brain how to figure out how to stop that itch. But we just do it. But Mayuri is paralyzed, and for her to even to blink her eyelids on the eye gaze computer, and the time it would take her to tell her aides what, where, when, and how to itch her nose is beyond imaginable. And nobody should have to be like this. I have a very close friend, Mark, who also has ALS. He is 60 years old, a Ph.D. from Yale in theology, and he still teaches theology at Loyola University. He is on his way to publishing another textbook right now with the help of his teaching assistants and with speech technology. For him, it started in his arms 3 years ago, and now he's totally bedridden and needs oxygen to survive. These were two people among the others we just heard today who are otherwise young and healthy, and they are dying a slow death. It's just a matter of time. They are more than willing to try any drug therapy. They're willing to take any risk, knowing full well it may or may not benefit them. They're willing to take any chances, knowing it might cause side effects. And they're willing to give hope to the other 6,000 plus people who are diagnosed every year with ALS. It's a win-win situation to pass this bill. We beg you to please vote and pass this bill. Thank you.
Thank you. I'm looking here to see who we've not covered. David, I can't see your last name because it's cut off in the picture. So Dr. David Calder, it says Calderwood.
Calderwood, Dr. Calderwood.
Calderwood, would you like to go next?
Sure. I don't know that I can add a whole lot to what's been said. I'm a family physician. I did ER medicine for 20 years and now family medicine for 16 years. How I'm my relationship to ALS is that a year ago, my daughter, 42 years old with 4 children, excuse me, I get way too emotional, was diagnosed with ALS. She has gone from a avid athlete in the gym 4 and 5 days a week in excellent condition to barely able to feed herself and barely able to walk. She has done all that she can do, and it's sad that medical science is not offering much to ALS patients. Functional medicine doctors, with helping try to remove toxins that may be part of the ALS picture and the etiology and cause of ALS, seem to be helping more than traditional medical doctors. And that's sad to say, but she has done everything from reducing her mercury toxicity, getting rid of mold toxins, taking supplements, and having genetic testing, and to very little avail so far. These patients would love to have access to a care that, even if it only brought mild improvement, or as Dr. Campbell said, just allow them to live long enough to see their children meet some milestones. I agree that with what has been said, that we don't have, that it is becoming more frequent. In my own practice, in this year alone, I have helped diagnose 2 patients with ALS. I went for 30 years without diagnosing a single patient, and now in 1 year, diagnosed 2. All neurodegenerative diseases are exponentially increasing, and the research in passing this bill will allow for advancements in all areas of neurodegenerative diseases, like has been said. I urge everyone to support this bill. It is nonpartisan, it is humanitarian, and it can benefit so many, and the rippling effects will be amazing if we can just pass this bill. Thank you.
Thank you. We are fighting for your daughter. Mayank, I know that you said you had something from Dr.
Hi, yeah, we also have one more. Dr. Peck, did you speak? I see Dr. Wallace Peck. What, there's no video?
There we go. Hi, Dr. Peck, unmute yourself.
Well, thank you so much. I want to thank my dear friends, the Vincents, who turned me on to this program, the Zoom meeting, and I learned a tremendous amount here today from all of you. And I'm so sorry for all of you who have family affected and you individually are affected. I've been practicing neuroradiology for 35 years. I'm doing neurointervention for a good 25. Just thinking as you guys are all reflecting on these things over the years, I remember, thinking about neurology. I remember it used to be the joke that neurology was, like someone mentioned today, diagnosed as subspecialty and really not a lot of stuff to treat. And within my time period in this field, neurointervention, there's been a massive paradigm shift in treatment of stroke. It used to be patients come into the ER with stroke and you put them upstairs on a pathway and that was it. And I can't count how many people's lives I've saved by pulling clot out of their brain now with these new devices that we have. And it's a huge paradigm shift. The purpose of me saying that is that I think that hopefully in these neurodegenerative disorders, it's time for a paradigm shift in this field as well. And our good friend, Peter Vincent, who is a great athlete and runner and everything else, retires to spend time with his grandchildren and gets diagnosed and has had a tough time of it. And so whatever I can do, writing this letter, supporting the Congress, from what I've learned from all of you, I will do my best. One other side thing out of it is we have a neurosurgeon at our hospital, Christopher Duma, I think he's treated 3 patients outside of the country, and he's trying to get money for a clinical trial, and it's held up right now. So this has a secondary benefit of hopefully me trying to, by supporting it with Congress, that maybe there will be more trials like he's trying to get through and support to help people like all of you. I thank you so much for allowing me to be here today.
Thank you, Dr. Peck, and appreciate that. I do have a prepared statement from Dr. Pai because her audio isn't working as well. So I'm just going to read that on her behalf. She's written that she's Dr. Akshita Pai. She is an adult transplant nephrologist in Houston, Texas. ALS is not a rare disease. I have seen the delay in diagnosis in this disease. 20 years ago, I had a close family friend diagnosed very late after symptoms. He left behind 2 young girls that grew up without a father. Now, again, seeing the nightmare of trying to get an accurate diagnosis for Mayuri, my childhood friend, this time as a physician watching a friend navigating the challenges of a diagnosis. As a physician, a delay in diagnosis negatively impacts trial participation, which is a disadvantage that patients with neurodegenerative diseases just don't have the liberty to live through. I think these bills have the ability to safely get access to these patients who need it the most. With a case fatality rate of 100%, They don't have any time to lose, and even a 35% chance of any improvement safely beyond what any successful trial would hope for. These bills can make a difference, and now is the time. That's from Dr. Pai. Thank you, Dr. Pai, for that statement.
Dr. Pai.
That's it, Michelle.
So I am touched and honored to share this Zoom with you. It breaks my heart for those of you who are living with this disease. It breaks my heart for those of you that are watching family members fight this disease, because I can't imagine being a physician who spent all of those years going to school to be able to help someone, and the helplessness that you must feel when it's you or a family member that you can't help. And so for you, we fight, and we're not going to stop fighting. I know that your voices will make a huge difference there are 8 members of Congress who have not yet sponsored this bill who are physicians, and your voices will make a difference for them. So we very much appreciate you spending your Sunday afternoon with us and giving us the benefit of your knowledge, your professional expertise, but also how this has impacted you personally. We sometimes forget that physicians are sometimes family members and affected as well. And so your perspective has been quite helpful to all of us. I will say as we close here that the NIH has forecasted that the incidence of ALS is on the rise. They've forecasted that it's going to have a 70% increase by 2040. That was about a decade-old forecast. One of the other things that many of you may not be aware of is some of the early studies that we are seeing in SARS and MERS in mice studies showed that there was some long-term damage coming to the neurological system as a result of those 2 coronaviruses. The research was halted when SARS and MERS did not take over the United States, but that research was begun again when COVID-19 hit. And sadly, the early research is showing that various RNA-based viruses are able to pass the blood-brain barrier and get into the neurological system and damage neurons. The virologists that we work with don't know what that means with the long-term implications in long haulers, but they do believe that we are going to see a spike in some kind of neurodegenerative diseases as a result of what's going on with COVID. We don't know whether that's going to be ALS or Huntington's or Charcot-Marie-Tooth or which form of neurodegenerative disease, but we have seen the early data demonstrating that there's some damage to the neurological system, and how that long-term neuroinflammation is going to impact neuromuscular and neurodegenerative diseases, we don't yet know. But it is one of the many other reasons that we are pushing for this bill, because we need treatments today. And I will close with a personal story of my own. I got involved in this world because I had dogs with ALS, if you will, 2 decades ago, and started looking into the world to find the data. What happened since that time is concurrently with that, I had a cousin in the early HIV research. So it was interesting to me that one of you mentioned HIV. He was one of the early patients diagnosed with AIDS in the 90s. And he was one of the first people on AZT. And he almost killed himself during that time because the side effects were so horrific. And his clinician thankfully said to him, stick it out, because there's stuff coming around the corner. We've got some really promising things in the pipeline. And my cousin, who had full-blown AIDS in the 1990s, stuck it out. And he lived until this spring, because just giving him that AZT, as horrific as it was, and with all the side effects that there were, got him to the next drug. And that got him to the second drug in the cocktail, and that got him to the third drug in the cocktail. And that's what we're asking for ALS patients, is give us the opportunity to get the access to that first drug in that cocktail, whatever it may be, so that we can live long enough to get to the drug that's in the second cocktail and the third drug in the cocktail. And there's so many people who are counting on this to watch, as Dr. Calderwood said, to watch their children grow up. We have young moms who can't breastfeed their own babies because they can't hold them up to their breast because their arms are paralyzed. We have young dads who have asked me, they just want to live long enough that their child recognizes their voice before they die. And when you hear stories like this, it is so incumbent upon us to ask Congress to fight for us. And I will say, as we close here tonight, you should know that there has not been any lobbying money that has gone into this bill, that this is 100% patient driven, that we have fought, that we've set records, that Congress's staffers have told us in all of their years on the Hill, they have never had a bill that has had so many patients calling to support it. And if that's the message that they're getting and people still don't pass this bill, we need to drastically fix something with our system, because this is how it's supposed to work. People asking our congressmen and women and our senators to listen to our voices, and we are screaming loudly with our voices to give us a chance. Some people have said they want to wait for next session to pass this bill. And as we mentioned at the beginning, 6,000 patients next year will be dying of ALS, and another 6,000 the year after that before money could be appropriated. So we're going to lose 12,000 people unnecessarily because we're simply not giving them access to some of these really incredibly promising phase 3 drugs. And as we close tonight with this being the holiday season, for whatever you celebrate in your own family, we've talked a lot about the holiday coming up and people who may have an empty seat at the table this year because they've lost someone in their family to ALS. And there are people in our ALS community who have the genetic form of this, who have lost 2 and 3 and 4 family members to this horrific, insidious disease. And so we are asking Congress as we close tonight, with all of the physicians who've given their Sunday afternoons to spend with us, for congressmen and women and for the senators to look around your room, look around at your dinner table, and ask yourself if you would be willing to give expanded access if it was one of your daughters or your son or your sister or your brother or your parents who you hoped would be with you at the dinner table next year, because that's what we're asking Congress, is to give us a chance to have our family members with us at the dinner table next year too, at the holidays. So thank you very much. We are very honored that you spent your Sunday afternoon with us, and we're hoping that Congress hears our pleas to pass S 4867 in the Senate, to pass HR 8662 in the House, the Act for ALS, which is going to help so many patients, give them hope, but also give them a chance to be with their families next holiday. Thank you, everybody.